Leanne Beagley is the new CEO of Mental Health Australia, and she's really kindly joined us today. Mental Health Australia being the peak body, the national peak body for mental health. We know Leanne from her many years working in Melbourne, and now she's headed to Canberra, from where she joins us today. I've known Leanne since the early days of her mental health career, which has spanned clinical mental health services, a clinician and a leader, and then the Victorian State Government, where she was the Director of Mental Health and Drugs at DHHS, and then more recently primary care, where she was CEO of the Western Victorian Primary Health Network. Leanne, it's great to have the opportunity to introduce you to our sector in your new role, and to have you share the perspective of Mental Health Australia.
Thanks, Jenny, and thanks for having me in the introduction and the invitation. Also about me is that my late husband Bill and I have 3 daughters, all in their 20s, and the middle one, Sarah, is a lawyer and a very new police officer. And she was working last weekend in Melbourne City on night duty, patrolling the streets, and she called me to debrief the next day. She and her colleague had approached a rough sleeper on a cold night and offered him a hotel room as part of the government's current housing program. And she called me to talk through her experience. She couldn't understand his declining the offer. She saw it as an opportunity for warmth, shower, rest and food. And I asked her what he said about why he didn't want to go. And her take was that he was comfortable with what he knew and he didn't trust the cops or the government. I've no idea if he was struggling with mental ill health or not. He left quite an impression on my girl, though, who's been thinking about it all week and thinking about him and what might happen to him and why he found himself there. And I wanted to launch with that because this is one of the ongoing complex problems. Housing instability, homelessness and mental illness are too often intertwined, and we do so poorly at times with it as a society that we're not surprised when people living with this complexity don't trust authorities, or they find a way to be comfortable in a place that many could not tolerate. I'd just like to join acknowledging that country and say that I'm on Ngunnawal land in Canberra, and it's cold. I'd just like to add. We know that there's an increasing awareness of the social determinants of mental ill health, the systemic disadvantages and circumstances that mean some people are far more likely to experience severe psychological distress than others. And we know that housing instability is one of these factors, and we've heard about it this morning from a range of amazing experts. Traditionally, we've tried to address these different needs through distinct programs and service models, but for people living with mental illness and housing insecurity, it's always been clear that these challenges and helpful responses are really inherently interconnected, and our service approaches, research and policy are finally catching up to this. And I guess what I'm here to say is that our governments need to catch up to this as well. Historically, the inherent interconnectedness of housing, security and mental well-being is clear from the data, and while COVID-19 pandemic has caused huge disruption to service provision, it's also created opportunities, as we've heard this morning, for different ways to respond and re-engage, like the provision of hotel accommodation for people sleeping rough. The challenge now is to reshape and improve our service systems to better support those in search of a home and those in need of mental health services. So, why is appropriate housing so important for mental health and well-being? Well, we've heard about that this morning. A home is, is about having more than just 4 walls and a roof. It should provide safety and security, enable access to support services and support the development of a sense of self and community connection. I think Laura called it citizenship. The importance of appropriate housing for positive mental health and well-being was acknowledged by the Productivity Commission inquiry into mental health draft report when they said, suitable housing, that is housing that's secure, affordable, of reasonable quality and enduring tenure, is a particularly important factor in preventing mental ill health and a first step in promoting long-term recovery for people experiencing mental illness. So what are the gaps in our system now? Clearly, the current system doesn't meet the level of need. According to the Productivity Commission, again, over half of all clients of homelessness services in need of long and medium-term housing did not receive it. I'll say it again, over half did not receive it. About 1/3 of clients with mental ill health needed but did not receive mental health services. Overall, there's a shortage of appropriate housing options for people with lived experience of mental ill health. And the trajectories research found that this is related to decreasing housing affordability, social housing shortages, and the lack of supported housing. Mental Health Australia absolutely supports policy moves to enforce no exits to homelessness from hospitals, mental health services, drug and alcohol services, and prisons. However, the introduction of these policies is not enough without provision of appropriate accommodation options. In some cases, it has just meant that people stay in institutions because there is no other place for them to go. The real need is developing increased availability of housing options. Surveys highlighted again in the Productivity Commission suggested around 30% of admitted patients, which is about 2,000 people, in psychiatric inpatient units could be discharged if appropriate housing and community services were available. The costs of not adequately addressing the accommodation needs of people with mental illness is evident through increased expenditure in the health sector in some cases, the justice system as well. The good news, I guess, is that research shows the effectiveness of interventions, and we have heard about some great programs this morning. Lovely to hear about Doorways, which I was involved with when I was the Director of Mental Health in Victoria a few years ago. The trajectories research says the quantitative analysis shows that mediating factors such as social support, good general health, and accessing mental health and other health services can reduce the likelihood of housing instability and shorten the time a person experiences mental ill health. So what do we need to do? Australia already hosts several innovative, high-performing services and models of effective housing support with a mental illness. People, with a mental illness. And these service models are not waiting to be invented. They're just waiting to be supported and expanded and given some longevity. Reforming the system will mean looking at it from the experience of people accessing services. This is what the trajectories research has done, mapping the real journeys of people experiencing mental health issues in the housing support system, which are of course rarely linear. We know where long-term supported housing has been provided for people living with mental illness, there's been significant associated reductions in the use of health, justice and community services. And we need governance to recognise the links between mental ill health and homelessness and provide investment in service reform across both sectors and together. They should actively work towards meeting the gap in supported housing places and homelessness services. We know there's a proven link between homelessness and mental illness. We know that most recently the bushfires and the COVID-19 pandemic have included significant emphasis on mental health planning and support provision. And we know that we're awaiting a whole lot of final reports from the Productivity Commission inquiry into mental health, as well as the findings of the Royal Commission in Victoria. What we don't know is how all the governments will prioritise mental health and homelessness, prioritise it while also recovering from bushfire and dealing with the pandemic and the existing and expected economic impact across our country. At Mental Health Australia, we'll continue to advocate for increasing access to appropriate housing and integrated mental health and housing supports, which are the key to tackling this problem. Congratulations from us to you on this great publication launched by Minister Foley today, and for keeping this issue front and centre in our minds. It was great to hear the experts on this intersecting work. Thank you especially to Nigel for telling his story. He said first that people were kind. If we can do this together, we will ultimately address people's basic need for a place to call home and then a community to feel part of. Laura called this full citizenship in a welcoming community. Thanks for having me, Jen.
Oh, thanks for being here, Leanne, and it's so great to have you in this national role and having you here today to meet everybody, I think, in that role as a start, I think, of a lot more work together to come. And I think underlining just the foundational need for the range of housing and support that is required and that we do have the service models. We've just got to take them to scale, as well as the opportunity that, gosh, we're all desperately trying to see realised in terms of social housing as stimulus in this COVID-19 set of circumstances. Thanks so much.